Question number 3. The big beautiful bill has cut healthcare coverage for millions of Americans. What would you propose to make healthcare accessible and affordable for all Americans?
I will tell you, since December 3rd, I've been able to travel through 26 counties that make up this district, 7 tribes that are in this district, and it doesn't matter which community I'm in, this continues to be the #1 concern of the people I'm talking to. I want you to know, first of all, that I'm not just making promises and I'm not talking about something that I don't understand. When I graduated law school, I became the elected city attorney of Crandon, the town attorney of Leona, the family court commissioner of Forest County, the family court commissioner of Oneida County. Whatever they asked me to do, I did, and it was all part-time. And you know what happens when you work part-time? You don't have benefits. So for years, I didn't have health care. Those years where you're capable of having children and all sorts of things go on with your hormones, I didn't have health insurance. I provide health insurance to every one of my employees 100% paid because that is important. No matter how hard that is on my profits, it's more important to take care of my people. So it's an absolute must. We must find a way to make sure every single person, citizen of the United States of America, will have access to quality, affordable health care. It wasn't until my granny passed away from cancer that I learned, did you know they have 2 different books in the billing offices? And you can go in there, and I was so shocked, I thought that this was just scandalous stuff, but no. She was being treated for cancer, and there were 2 different books on the prices that they charge, depending on who you are, what your insurance is, or whatever's going on in your life. I was floored. Did you know that even though there's already a law against it, pharmaceuticals continue to give kickbacks to doctors if those doctors will prescribe their medication? I'm sure you already know that we have counties like the one where I live in Forest County, where I was raised and where I work in Forest County, there are no OBGYNs. We have pregnant ladies and their families having to travel across county lines to get OBGYN care. It is absolutely necessary that we reinstate what we have under the Affordable Care Act, and then from there get something even better. As Chris says, and I like to say, you're only one of 435. The good news, there are 96 ladies in the female Democratic caucus that I have been admiring for far too long. I'm ready to join them. That means we'll have 97 votes ready to make sure that we can do something better. And what do 97 ladies want more than anything? Health care for families. So I'm absolutely confident that we will be able to lead the way to a better situation so that everyone will have access to affordable health care. Send me there, I promise you, I will do everything I can to make that happen for you.